Okay. Hi, everyone. Welcome back to What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro. And today we have Emma Robertson, one of our own. We've been trying to get on this podcast because she has such an important story to tell us about her suffering and now her getting out of that suffering with a lot of the things that you may be suffering with right now. So, Emma, thank you so much for being here.
Yes, of course. I'm so happy to be here today.
So we met because you were going through some similar symptoms. And you're also, I have to add in, you're a nurse by trade. So you already had background knowledge of the human body and the way that you've been able to integrate that, knowing what's going on in your body and seeing what helps you has, I think, is going to be really helpful for people here. So I just wanted to mention that. But can you tell us a little bit about yourself and how you ended up working with us? Like how, like your symptoms, how they turned on, what was the trigger? Like the more you can tell, the better.
For sure. So, about 3 years ago, I started working. I graduated from university, started working as a nurse. I was in a very high demand job. I worked a lot of hours and was kind of just someone that overburdened my schedule.
A lot of people
Sorry.
can relate with that, overburdening their schedule for sure.
Yes. So yeah, I was just very busy and I started noticing that I was getting some sensations. I had a little bit of gut discomfort. I've always kind of been someone that's had gut issues, a little rash here and there, a little bit of underlying anxiety that I kind of just pushed aside and I just kept going, kept pushing forward. Like I had to do, everything on my to-do list. I was just kind of a perfectionist, like type A personality. And I just kept going and it was working for me as I thought. And then one day, I crashed, and that's when all of these symptoms kind of turned on to a whole nother level. And I want to say too, when I had all of these gut symptoms, I was kind of restricting my eating very, very clean. I wouldn't allow myself to eat any gluten, dairy, the list goes on. And I really wasn't eating enough calories for what my body needed and for the demand that I was putting on my body. And I want to say a big thing that contributed to my crash. My body was just like, you know what? I've had enough. And it stopped me. It stopped me right in my tracks. And I want to say it was the most scary day of my life because I had a long list of very scary symptoms. Yeah, that's kind of how it all turned on.
Was there anything else that triggered that change in your health that stands out at that time?
So when I first got my job as a nurse, I was required so many vaccines. And I noticed that after I got those vaccines, I didn't feel quite right. And it's like, oh, whatever, it's just probably a side effect, it'll go away in a few days. But looking back on it now, I think that also kind of was a big boiling point to how all of this kind of overflowed. I remember going to hot yoga about 2 weeks after all of that, and I thought I was going to faint. It was the first time ever that I had gone to yoga and felt so sick. Whereas before I was very active, running, 5 kilometers a day, doing hot yoga, working out, this and that. And then I remember 2 weeks after that going and feeling so awful. I saw stars. My heart was going so fast. And I literally had to get up and leave the yoga session. And I just remember walking straight to my car, not even saying a word to anyone, and sitting in my car and be like, "Oh my gosh, what is wrong with me? Something is completely terrible right now." And it was one of those situations again where I continued to push. And that was probably about 9 months before I crashed, like I talked about earlier. But yeah, I want to say maybe that also contributed to,
Yeah.
crash.
Which vaccines did you get at that time?
Flu, um, hepatitis, and COVID. And yeah, all at once, which, now knowing
Yeah.
that was.
Yeah. So, I mean, with any intervention, right? Even whenever we put people on supplements, we're like, pay attention for any side effects. Like, do you feel funny? We microdose, we try and build everything up. So, you know, anything that we put in our body it can create a reaction, right? Especially when there's different, we know there's metals in certain vaccines. We know COVID and the COVID vaccine can really change your immune system in certain people that don't have great detox or maybe have some other stealth infections that were hidden in their bodies, right? So we always go to say like immunotherapy can be so powerful. It's just sometimes the things that they have to add to the immunotherapies to stimulate the system or to keep these things preserved that aren't great for everyone's body. And like you said, we're not saying it's that one thing. Like you had multiple things that were adding to your toxin bucket, your stress bucket. You didn't have enough nutrients to withhold all the stress that your body was under from all the working. And these are things that people can speak to. And then the thing that, tip our proverbial toxin bucket. And then our body is no longer coping. So we can go from our toxin buckets almost overflowing and we still barely have any symptoms. That's subclinical in our world, right? So you don't have any clinical symptoms yet. And then once that bucket tips and your symptoms turn on or your immune system loses control or your inflammation is not regulated anymore, depending what the toxin is, what the infection is, like we start to get these scary symptoms. Our symptoms are always caused by something. So you had some scary symptoms. So what exactly were you feeling? Because we were talking about this before and we don't feel that people are explaining these symptoms properly enough that people understand what's going on. So what is it that you were feeling?
Yeah, for sure. I wanna say I had, like, 50 symptoms, and, like, I'm gonna, like, label a few, but honestly, I might miss some, and I feel like I probably had everything under the umbrella of, like, symptoms. So, my scariest ones were, like, the POTS symptoms. I had, a fast resting heart rate all the time. I had heart tests done, and they're like, "Yeah, your heart is just, like, very fast, resting at, like, 120." Laying down, I couldn't sleep. I'd get these scary, scary PVCs where like my heart would do somersaults in my chest and like I couldn't get them to stop and I would be panicking more and the adrenaline would come. So a lot of heart related symptoms I had. I had heart tests done and they just said you have really bad anxiety, you have, you know, inappropriate sinus tachycardia, POTS, like, I don't know what you have. They had no idea. And then just kind of, tell me to take, a beta blocker and go about my day like everything was fine. I had um inability to digest any food. I would eat food and it would sit in my stomach for hours. Panic like symptoms constant, like underlying like my baseline was panic. There was nothing else, no rest, nothing. I wouldn't sleep, insomnia, nausea, numbness and tingling, exercise intolerance, heat intolerance. I couldn't go to grocery stores without wanting to faint, vertigo. I don't even know, like
Okay,
just so
so you touched on a bunch of symptoms, so let's kind of go through them. So you said POTS-like symptoms. So if people don't know what POTS is, POTS stands for postural orthostatic tachycardia syndrome, right?
yeah.
And tachycardia means a fast heart rate. Postural means changes in positions. The test that they do to diagnose you with this is they take your blood pressure laying down and then they take it standing up and they see the difference in between it. So what happens there is our blood pressure and our arteries and our veins, they all have to change their diameter very quickly within seconds, right? So when we have that, there's some sort of delay. We see this in people that have head injuries, right? We see this in people who have, like, all these infections that we're talking about, infections and toxic load, when the body stops accommodating, adapting. Our adaptation becomes a slight millisecond different, and we are going to feel scary symptoms because for 1 second, if we're not getting the blood to our head like our body wants, it's going to go into this fight or flight like symptoms, right? Mhm. So it's almost like a dysautonomia. Everyone talks about the vagus nerve. We're the vagus clinic because the vagus nerve affects everything. The whole reason I called it that is a completely different reason to now the vagus nerve trended, right? And so there's lots of bugs and pathogens and infections that can create dysautonomia because things can actually infect your vagus nerve, which people don't realize, right? Toxins that can't clear through your lymphatics will sit in your neck and cause toxicity to your vagus nerve. And that is a systemic effect because the vagus nerve is in charge of our parasympathetic nervous system, which is our rest and digest side. And that's what takes the blood flow and puts it to your digestive system when you need digestion, right? And then we have our fight or flight, and that's when it takes the blood flow away and it sends the blood flow to your muscles, to your eyes to get more blood so you can see and your pupils can dilate and let in more blood. And, it changes your system to more adrenaline based. So our bodies are getting these confusing signals because we're getting hijacked. So that's why I'm like, do you agree with these symptoms you felt hijacked?
100%. I honestly, like, I wanted to crawl out of my skin. When I say I felt fear on a whole nother level of fear. And like, that's what I lived every day. And I can have so much empathy with people that are going through these symptoms because when people say they feel fear, I felt like I felt fear times 100. And it's so hard to explain unless you're going through these symptoms. But yes, back to the POTS symptoms. It was interesting too because when I did get tested, my heart rate, so when they tested my blood pressure laying down, sitting up, and then standing, it constantly got higher and higher and higher. So a lot of the doctors were like, "You're just very anxious. You have panic disorder. Like, this is not POTS." And what I've come to realize is there's different types of POTS. Hyperadrenic POTS is
Yeah.
technically what I had. And it is still a form of dysautonomia. It all falls under the same umbrella. A lot of the times these doctors will be like, "No, you don't have POTS,
Yeah.
um, because your blood pressure goes up."
Yeah.
And, with POTS, your blood pressure doesn't always drop. It can actually be the opposite effect where your blood pressure is going way too high,
Yeah.
which was happening to me. So
So
yeah, just a
yeah.
note on that.
So
Mhm.
when people wear like the consistent blood pressure monitors, which again, blood pressure monitors are so hard because they're squeezing, like for you, especially because I went through the same thing, your blood pressure will go up just from the squeezing because it creates that fear and panic. Our body's too
Mhm.
hyperreactive already. It's hard to get like a true response. But when people actually, what we're seeing when they're having these symptoms is their blood pressure is all over the freaking place.
Yeah.
Like, and that's the part where you get the fear. Then there's also small changes in blood sugar all the time. It's going low most of the time, right? So like
Mhm.
it's your whole system has kind of lost control of all those tiny intricacies that need to be in place and changing like within milliseconds that we no longer have. And so a big way that I feel like I explained the symptoms that I had that were similar to yours are a sense of impending doom, jump out of your skin anxiety, but like they were physiological. Like my heart rate was exactly like yours, super high at rest, super high all the freaking time. Like, and
Mhm.
never mind if something was the slightest bit stressful, right? And that's not anxiety. We weren't having anxiety because it would be in situations where we don't have anything to quote unquote feel anxious about. And it could come over us like just like this wave, like that wave where you feel like everything's coming up and you're like, vibrating almost.
Yeah.
And that's like a whole other thing, but these are key things where your vagus nerve are infected. Like this is what people don't understand is a lot of those symptoms. And a lot of these symptoms are so common right now because COVID, the way that it can infect your vagus nerve and infect around your heart, like the spike protein can get into through your ACE2 receptor. And this is why people and nicotine can be so helpful because it will take the place on that receptor so these things can't get in. So 99% of the people, if they would do tests, which it's hard to do in Canada, if you tested your spike protein would be super high. So, but it's not just that. Then you bring out all these other infections. So we see Babesia high, and Babesia is a parasite, which we can get exposed to, but our body can keep at bay for so long that also creates those heart symptoms. I had legitimate heart pain because I had Lyme carditis because I had Lyme in the past. And then the COVID had dysregulated my immune system so much. And I also had a mold exposure. So again, it's never just one thing. And that's why some people get quote unquote long COVID or symptoms from the vaccine and person B does not, because depending on their detox, their amount of stress levels, their nutrition, like, are you already an anxious person to begin with? Do you have enough nicotinic receptor? Like we all we get one of the nutrients, which is B3 is nicotinamide, right? Like, so we like niacin and all of that are all precursors. So we all have different levels of things that make us more prone to these issues. But this is now they've coined it like kind of like long COVID. And it's the same like symptoms that you've described that can be all over your body. I had severe lymphedema, right?
Mhm.
I felt your lymph, it felt stuck, but yours wasn't super duper puffy or anything. It
Yeah.
was more deep lymphatics. And that's why we got more into treating around the organs and stuff. Because to me, the PVCs, which you said PVCs, those are preventricular contractions, they are like, they feel terrible. They're terrifying. And one of the times where I had a cluster of those and I felt like I was going to faint was when all my lymph was clearing through my heart. And when you're having these symptoms, you have so much toxicity because you're not clearing things as well anymore. Your mitochondria go into the cell danger response. You don't detox properly. Things are just floating around in your system. And so now they have to clear through your lymphatics. And even that irritates the heart because the heart is electric and there's a lot of metals, there's a lot of waste, there's the actual spike protein, there's whatever it is that our body's getting rid of that now has to go through the heart. So, that's why massaging the heart, which again, you can talk about how that helped you because we're always like massaging around the heart to clear those lymphatics because the heart is electric and they get this structural pressure on it too when we can't clear from around it. So can you talk, we're going to go into now things that help, but okay, I wanted to explain what a PVC was. I wanted to explain what the POTS was. You even said the tachycardia, the inappropriate tachycardia, which
Yep.
just means like your heart rate's high for no reason because you're not even working out or doing anything. You're just supposed to be resting. So people can talk to that. All of these things can make you want to faint or you do faint, which I had fainting episodes. I'm not sure if you did, but you felt like you were going to faint. You were close. Right.
Yeah. Another thing too was you spoke about the blood sugar, and actually that was something I really struggled with was my blood sugar would drop a lot for no reason. I had a lot of reactive hypoglycemia, which would make me feel awful, and then it would cause more adrenaline dumping into my
Yeah.
system. And it was just this whole cycle of like adrenaline, and my body just hyper reacting to so many things. So yeah.
Yeah. So again, your body hyperreacted to so many things. Like your body created a lot of mast cells. They create a lot of histamine. Histamine does all this dysautonomia, right? So it's just like tying these things together for people. But like what I see online right now is like this mast cell activation is like blowing up, and everyone's like, you take this antihistamine and that antihistamine, and that's great, but we can't forget the underlying causes. Like we need to break down and digest the spike protein. We need to find the other infections and help our body usher them out. We need to support our mitochondria. We need to support our electrolyte balance, which, that creates the electricity in our heart. And we're going to talk about that because you talked about adrenaline dumping. And for you, something really helpful, which is really helpful for even histamine was, getting your electrolytes up. So you can talk about some things that really helped you now, if you care to share.
For sure, I'd love to share. So at the beginning, when I first found you, I think something that really, really helped me was binders. In any of these acute flares that I would have, I would take a binder, either biotoxin or Tox-Prevent. Those ones were my two favorites, especially Tox-Prevent because I had a lot of stomach issues and just like these weird sensations in my stomach, a lot of acid in my stomach. And I think, well, I don't think, I know that the Tox-Prevent helped bring down the histamine, which helped calm down my system. And when my system was calm, it could then, move out the lymph better because when I was so tense and all of these things were going on, my body just couldn't respond the appropriate way that it was meant to respond. So a lot of binders were helping. And yeah, back to the electrolytes, I came across dry water and just honestly electrolytes in general, coconut water, any electrolyte that you can get your hands on was so helpful for me. The potassium especially was helpful. Honestly, it helped me out of a lot of panic situations because when my body was producing all of this adrenaline, I was going through minerals, vitamins, electrolytes at such a high rate that my body really couldn't keep up because once again, I had no appetite. I definitely wasn't eating enough. And that's something that I really, really want to make mention of is diet. We live in a world now where there's a lot of fear around food. What food is safe, what food isn't safe. And, yes, that is important, but it's also just as important to make sure you are eating enough. Because for me, I had so much fear of everything that I wasn't eating enough at all. And my body was just starving for nutrients. And so that was something also that really helped me is that when you are going through this, to make sure you are eating like whatever your body can take in. Maybe it's a protein shake, maybe it's like an apple here and there, but like honestly, every 2 to 3 hours, like I needed a snack. My body was just in such a state of sympathetic, and I had to accept that, and I had to then nourish it properly, which I wasn't doing before. So that and electrolytes were super, super helpful to me. I want to think of what else. Slow movement, walking, being in nature, grounding, getting back to the basics. Like, if there's one thing you can do, and I would recommend, is making sure you're eating electrolytes, binders, and walking, grounding, a lot of warmth for my body. Like, I would take a heating pack when I was in this state of panic or when I was having a fast heart rate, and I would just put the pack on my chest, massage my lymph, my clavicles. Stretching would be really good too, because honestly, if you can't lift weights or do any kind of like really intense exercise, your body still moves lymph with slow movement, with walking, with stretching, with breath work, honestly, making sure you're breathing. I was always holding my breath. I wasn't breathing enough. So every once in a while, I would just say, okay, like, I'm going to notice my breath right now, and I'm going to take 2 minutes to just breathe and be present with my breath. And yeah, just adding like little things to help calm my body the best way I could, while also making sure I was doing the supportive things it needed, like the binders and, the supplements and the minerals that you recommended were just all so helpful.
Yeah. So just so we talk about binders all the time, but I'll just
Mhm.
clarify for people. So binders are substances. I often use this example because people know if they drink too much alcohol and their stomach gets pumped, or they've heard of a friend that did, they pump charcoal into your stomach to absorb the alcohol. So charcoal's one binder and that stays locally in your gut, right? You talked
Mhm.
about toxiprevent. That's an extract from zeolite called MANC. It's like a very specific extract that is very high affinity to bind up histamine, ammonia. It also gets a lot of mold toxins, heavy metals, and it's very easy to take. It's a clay-based thing. It's very nourishing. They even have one mixed with like calcium carbonate for when you do have even more acid. And so that is one that we find really helpful and really moves the needle. And there's a lot of confusion on binders on, oh, I can't take them if I'm still in mold. I can't take. You need to find a binder that helps you. I do not care which one it is. This is what we do with people. We even send sample packs now so they can figure out without buying an expensive binder, because binders are expensive. But the
Mhm.
other one you talked about was biotoxin. I really liked carboxy. I really liked humic fulvic from Mother Earth at some points, because at different times my body needed different things to be bound up. So the ones that are more humic and fulvic, they can go into your bloodstream and they're absorbing stuff in your bloodstream. Often just absorbing a ton in your gut so that it doesn't recirculate into your bloodstream is enough to help people, but you have to not be scared of binders and you have to figure out which binder works for you. There's chlorella. Glutathione can act like a binder. Certain antioxidants or plant polyphenols can act like a binder. So I don't care what it is, there has to be something that you find that takes the edge off, because if you do not, I'm sorry, but good luck getting through these symptoms. Because I've seen people that are following this dogmatic approach online where they're terrified of binders and they are not moving the needle. They're not getting anywhere. From two people have been through it, you need to listen to us because we've had your
Mhm.
symptoms, right? Like, we're not just saying this from a point of view of theoretical. This is, and we might just be anecdotes, but how many anecdotes do you need before it's better than the gold standard, which is the placebo effect? I don't know. But all I know is that this is what we see work. And if we don't, if people that refuse to take them, they're in and out of the hospital still, they are not moving the needle, they're not getting better because there's too much waste in your body for your body to handle right now. And those binders will bind on and not be able to bind off once they're bound on until they're carried out of the body. So, that's our big advice here for today is definitely find a binder that helps. Okay, so binders, electrolytes, like you said, when your
Mhm.
body's dumping all this adrenaline, all this cortisol, you're burning through minerals like crazy. So trace minerals are the ones that we use that are in like the little droppers, right? But then we need our macro minerals. Those are things like sodium, right? Your blood pressure is going down, you're burning through sodium as well. Like, that's why it's fluctuating. Your potassium, when it's too high, you need more potassium. The number one thing we see with this when people do blood work, when they're in a flare of these heart symptoms and this dysautonomia, is that they're burning through potassium and their calcium is super high. So things like vitamin K2 shove the calcium back into the bone is going to be like super, super potent. GABA, you had a hard time with, but it helped me a lot. GABA helps you put calcium where it should be and it helps lower calcium when it's too high. You used calcium channel blockers. Although that's not the answer, they helped you, right? To bring down, because our calcium's too high. We're getting also exposed to so much more electricity than before, right? Dirty EMFs, a dirty electricity, Wi-Fi from 5G. 5G affects our cells in a different way. It affects our calcium regulation. So, add to the toxin bucket list that now you're getting exposed to that. And that is a huge thing that adds to this dysautonomia as well. So it's like the perfect storm happened for Emma, the perfect storm happened for me, and then it tipped our toxin bucket, and then we had these terrible, terrible symptoms that we wish on no one. So let's go back into some other things that really helped move the needle for you. So you talked about, just like that things that were like warm. Like I loved the flex beam on my chest. Some people red light can even be irritating, but the warmth here can help things flow better too when it's over your chest and heart. The massaging your chest helps to clear those toxins, like we said, so that you can, because managing your symptoms is what takes you from, spinning out of control and then creating more waste in your body, or calming yourself back down and letting you clear the waste that's already there. Right. So also, mentally having to tell yourself you're safe when you don't feel safe, but you've now realized, okay, my heart is doing this, but I'm not having a heart attack. So it's not going to kill me, although it feels like it's going to kill me. You have to talk yourself out of this mental mind, like complete. I don't even know the word because I want to swear right now. And I'm trying not to, but it's like literally, you feel like you're going to go crazy. You feel like you're going to die, and you have to like realize that you're not. So once you realize that, like we ruled everything out that was wrong with our heart, then you've got to work through these symptoms in a way that you don't overreact to them all the time so that they create more damage in your body, right? So it's a very big test of mental strength going through these symptoms. And I think when you come up on the other end, you're definitely stronger, but I still don't suggest anyone having to go through these, that's for sure. Yeah.
I think for like a year, I convinced myself that I was dying, and it felt like I was, but it wasn't. That mindset wasn't helping me. And something that I've continuously repeated to myself, especially when I was in a symptom flare, is that discomfort does not mean danger. And when I was having heart palpitations, when I was having these scary symptoms, I would take a second, I'd be like, okay, this feels super scary, but I now know that discomfort does not mean danger. I am not in danger right now. I am just in discomfort. And even just having that mindset and repeating that to my body out loud would bring my nervous system down. It would bring it down so that it could do what it needed to do. And our bodies are so amazing. We do not give them enough credit. Like they were designed to heal, and they will heal just as it heals a cut, just as it heals anything. The body is always trying to come back to.
Homeostasis.
Thank you. I was blanking. It's always trying to come back to homeostasis. Our bodies are amazing. They will heal. You will heal going through this, but trusting your body despite when it doesn't feel very trustworthy. And that is something that I really, really had to learn. And that is something that also helps move the needle for me, because I could sit here and I could do all of these things, but if I am stuck in so much fear, my body won't allow it. It won't allow it to work. It won't. I needed to trust my body. And even though it didn't feel trustworthy, it was trying to help me. It was sending signals to try to get my attention that it needed something. It needed attention in some area. So yeah, when you are going through these, sensations and these very, very fearful sensations, like you are not alone. I hear you. And I need you to tell yourself that, discomfort doesn't mean danger in this moment. And then take a moment and say, what does my body need right now? It needs a binder. It needs some maybe electrolytes. And as you heal, as your body heals, because your body, it's going to go through waves. And even in that dip, you're not where you started. And you need to remind yourself that, yes, I am a little bit in a dip right now, but I am also so much more healed than I was 2 weeks ago. My body has healed. It has healed, and it's going to continue to heal. So you just got to keep going. And it's just like, the analogy of a nail. When you keep tapping at a nail, even if it's little, the nail will eventually go in. And it's like when you keep tapping at this, when you keep working at it, when you keep doing, doing the things that you need to do, you will heal and you will get your life back. And I just want to send that as an encouragement, because that is something that I really needed to hear when I was going through this, is that my body was designed to heal, that it will heal, that it's not fighting me, that it's not against me, that it's sending me signals, because yes, maybe there's some mold that I'm in, there's an infection, And we can treat all of these. Like, these are not like your life is not over. It's
No,
not over.
no.
Yeah, I just really want to, tell people that who are really stuck listening and feeling so, so scared. Like,
Yeah.
I know what it feels like.
And also, that's why working with someone who's been through it that can talk you through those times can be so powerful in those moments. I'm not saying your practitioner has to have lived through it. I'm just saying, like, there has to be some empathy. Like, they have to understand those things. Because, I mean, even I'm a practitioner and I needed guidance through this and I needed reminders when I was in my dark moments, and I had many. And, I just think that that's super powerful. So it's the same thing, like, even when we're treating people like with manually, sometimes we go deeper on the fascia, like when we have to loosen, but it's the difference between hurt versus harm. Like, ouch, this is hurting you, but I'm not harming you. You're going to be better in the long term. So the way that you explained it, I think, was about like it feels like you're in danger, but you're okay. So once you know that, like, because obviously there's times for people that are having like a heart attack, like, because things don't go in waves and then get better. Things, we had ruled out everything. So just, your body, if you can calm down when you're in these chronic symptoms, that is how you heal. Because this is chronic. These are, it starts off acute, which is
Yeah.
terrifying when it turns on. But
Hmm.
unfortunately, I haven't seen it where it hasn't taken at least a certain amount of months to clear in people. And the healthier people that I've worked with that we caught quicker, like I had an NHL player, but because we already knew each other and his heart symptoms turned on so abruptly and we found the trigger and we could take it away way quicker, we could get better. But like, a lot of us go into these symptoms and we don't really understand. No one's teaching us what's happening with us. So finding someone who understands. So that's what we're hoping this podcast, you listen to it, you have your aha moment, and you can, start to get the proper guidance. So, we named a few things that were really helpful, but there's the background work that you have to do to help the immune system clear out some stuff or just support the immune system. These are all, we talked more about the stuff that are like, these are number one, like, staples, that everyone needs. Everyone's burning through minerals. You definitely need a binder if you're having these symptoms. I mean, arguably everyone needs a binder right now with how toxic the world is. So, if you're interested in those, like, start to figure out or reach out to us, and um, we can help find, or you can cycle through different ones. I think even like, Shilajit is getting like popular right now. It's trending. I don't think that's a bad thing, but make sure always whatever you're using is clean, because these binders can be dirty if they're not refined, because they're from the soil and the earth, and our earth is definitely somewhere from the Himalayas. Whatever they're from, they have to be, you have
Hmm.
to find a reputable kind of source to use them. Okay, so we touched on a few symptoms. What about like pain? Was pain a big part of yours? It was huge for me, but
Yes, I would have pain. I didn't think that was my main symptom, but I had a lot of muscle tension. So, I was constantly, girding and my muscles are very, very tense. So I had a chronic muscle pain, I would like to say. And then I had a lot of stomach pain. I had gastritis. That was another thing that I had. I wasn't breaking down food and food was sitting in my stomach for a lot of the time. So I had a lot of irritation just like in my upper stomach. But then, yeah, the muscle pain too. Like, my body was very inflamed. So yeah, I guess you could say I did have pain.
yeah. Does the Lyme hug, or like that, did you get the mid back thing? A lot of people get that severe like mid back tension up to their neck. It's called like Lyme hug. Like, your Lyme wasn't that high, but there's also like multiple other infections that create that like tension in the mid back, that people used to call it even an MS hug. But it's the same type of, the lymph isn't clearing from the back, and then people get a lot of pain in between their shoulder blades up to the back of their skull, like that kind of stuff.
I didn't have the back pain, but I had the skull pain. I had that. Like the back of my skull was very tender to touch. Yeah, that was a very like bothersome symptom that I had for sure.
Yeah, yeah. And you were able to get treatment. How much do you think that helped you through symptoms?
Yes, treatment was definitely very helpful when I was in those flares. I remember just texting Leah, my treatment girl, being like, "Can you come treat me?" Because treatment helped move my lymph when I couldn't move myself. Like, it helped get into, releasing the fascia. And then when the fascia was released, the lymph would just flow. My circulation would come back on. And it would be like, I would have this treatment and then like my color of my skin would come back because my circulation would just, come back, lymph would move. And,
Yeah.
you know, even if you can just get your partner or
Yeah.
friend or someone just to like lay hands on you and push those muscles, like, if you can't get to treatment, like treatment 100% helps me. But yeah, like in times when I wasn't able to get treatment, I would get my husband to just, massage my shoulders, get into my back, like, massage my neck, get the lymph away from my vagus nerve. Like,
Yeah.
all of that was helpful. You could even just do like, for me, like some cold and then hot therapy.
Yeah.
Couldn't do cold showers, like, it was way too strong for my body. And I think that's another thing to point out is, like, what works for someone doesn't it may not always work for you, and that
Yeah.
is 100% okay. Like, not everyone is the same, everyone responds to treatments differently, because I would try to, like, force treatments on my body that I knew completely helped someone, completely healed someone, and it didn't work for me, and I had to have grace for my body, be like, "That's okay, that's not what I need, and that is totally fine, but
Yeah.
this is something that helps me so much, so I'm gonna continue doing that."
Yeah, let's talk about one of those because I was there for one, and one was the vagal stim, which really helps
Yeah.
people. But I was similar to you, where I didn't need any extra electrical stim added to my body. I already felt too electric, and it was really a detriment for me. And then it really helped some other people, and it really helped your friend, but it didn't help you so much. So let's talk about what you
Mhm.
felt when you did that time.
Yeah, so I had the, just like the one that you put on your ear, and it causes, like, little vibrations to send and stimulate your vagus nerve, which it did, and it actually made me so much worse. And I think part of the reason was my body was just not ready for that. And people are very interested in the vagus nerve, the vagus nerve stimulation, like all of that. It's very interesting, but it comes with a time and a place. And I now do some vagus nerve stimulation, like the eye movements, which are helpful. But yeah, the vagus stem, like it completely helps my friend with her POTS and dysautonomia, and it literally sent me into, like, the worst week of my life.
Yeah, and so that's why we teach people that, like, microdose something, actually
Mhm,
listen to your body. Anything, especially when you're in that state, can throw you into a loop, and you have to listen to your body. You have to start to really, really
mhm.
in introspective. Sorry, I cut you off.
No, 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 not at all. Yeah, listening to your body. I think that's something like being someone that's an overachiever type A personality, I force a lot of things that don't, I had to really slow down and I had to really realize, like, okay, this didn't work for my body and that is completely okay. It doesn't mean that I'm not going to heal. It just means that my body didn't like that and there's something else. And I feel like if you sit and really, be intuitive and like, you try little things here and there in micro doses, you will find what works for you. And when you don't know what it is, start with the basics. Start with, drinking a little bit more water, adding something that's, easy for you to do. Don't overwhelm yourself with all of these things. There's a lot of things that we could do for our bodies, but it doesn't always need to be 0 to 100. 0 to like 50 and or 10, starting at something simple like with a binder and just, starting walking and movement and maybe having someone treat you when you're able to. Yeah,
Yes.
making sure you're eating. Eating, like, for me, that was a big one because I wasn't eating. I barely was eating, and I didn't realize that until I started eating more.
Yeah, and so if people don't realize also, when you're fasting, your body goes into it wants to go into something called autophagy, which is like it's trying to clean out your cells. But if you have a whole bunch of cells in what's called the cell danger response, or they're not going through that phase of cleaning out, or if they do start detoxing and cleaning out, but you're already so toxic, it is
Mm,
not great. So fasting when you're in these states is usually not going to be your best friend. And actually, even being more ketogenic or carnivore sometimes is stressful on people's body because the way that carbohydrates are way more calming for our nervous system. But I
mhm,
think that also, like, all of that, because, like, again, I tried that. I tried fasting and I got shingles, right? Because I was like, screw this one day and, try to force something. And my body detoxed too much. I had to deal with the whole stress on my body of active shingles, which is so painful and
mhm,
nauseating and like referring down your nerves. And, even then I tried carnivore, but my liver, when your liver is overloaded and you don't like nothing's functioning right. Like I had severe liver pain from trying to do just meat. So like I mean, we've really got to like listen to our bodies because then I
Mhm.
have patients who do carnivore and it's like magic for them, right? Like, so, and then you can do things for too long. Like I pushed intermittent fasting for too long at one point in my life and, shifted something. So, like, again, you really have to start to listen to your body and see what actually is working
Yeah.
for you. So, that's also what we try to listen to for people and try to, get them more intuitive for their own.
Mhm. Yeah, like, I had to sit and say, like, "Okay, what is my body craving?" Like, I forced it to do, like, the same thing, carnivore, I had to be vegan, I did medical medium, I did all of these different fad diets, and, like, I forced it upon my body when my body was like, "That's not what I want. Can you just, can you eat a sandwich?" Like, "Okay, I'll eat a sandwich." And my body was like, "Thank you. You're welcome." Like, it really was telling me what it wanted in that moment. Sometimes it doesn't. And that's where you came in and you literally saved me on so many levels. Like you said before, like, having someone that understood that could talk you off the cliff when you needed to be talked off a cliff. Cause there were many moments when I called you stuff. I'm dying right now. Like, can you please, like, something? I need something. You're like, Emma, you're not dying. Like, you were able to guide me on what I needed in that moment. Cause sometimes when you are in these states, like, your body, like your brain turns off quite like legitimately. Like you can't consciously think about what you need. So having someone like, a practitioner like you that, you went through the same situation, you were able to remind me of what I needed to do. And then once I could calm down, I could really listen to my body and be like, okay, yeah, like I am okay right now. Like I need to eat this, blah, blah, blah. Like I was just able to get my conscious brain back when it
Yeah.
wasn't there.
Yeah.
Yeah.
It's because it's that hijacked feeling. So I remember a practitioner I really respected at the beginning of my like severe symptom pattern is like, you're just, it's trauma. And I was like, it's trauma? Really? And I see that right now online. It's almost like gaslighting in the other way. If you, I'm not saying there's not a trauma component that you can work through at some point, but tell me when you were in these acute situations if like, trauma work was what you needed at that time.
No, no. I needed something a little bit more than that. I tried the trauma work and yeah, I think trauma work serves a huge like, purpose eventually. It does
Probably
because you
now at this point,
yeah,
right? Like now,
yeah.
because like what I explain to people is like I have been in the flow of life before. I have felt connected to the higher power, be it God, whatever people call
Mhm,
it, and I felt disconnected. I felt my soul was on its own. Like it makes me want to like cry and like you had the emotional through all of this, right? And it was like now and I did. I went and I did like a Joe Dispenza 10-day thing in the middle of these symptoms. I forced myself to get on a plane. I was in Colombia. I was electric. I was
mhm.
stressed to the nines, like, and then they want you to get up at 4 a.m. and meditate. And like I got some benefits from it. I'm not saying that in some of the walking meditations and stuff. And, I think all of that's important, but I'm saying you have to meet people where they are in this too, because you're so hijacked. Telling someone to sit down and meditate is not feasible. But meanwhile, telling someone to get something that relaxes them, which is massaging their own neck or getting someone to massage their own neck, taking something into their body, eating more food, like those are the ways that you can start. And then you can build up to these like very powerful aha moments because you have to start where the person is. And when you're in your physical symptoms, you need something that helps you in that moment with your physical symptoms, right?
Yeah,
There are layers to healing and sometimes you can't start with the spiritual when you're in the body, right? Like when you're in the physical. So like all of those things are important, but there's a time and a place and I think those are hard to understand for people. And another thing that's bothering me that I'm seeing online is people are going, this is the one thing that helped me. And you're like, no, it's not. You did 50 million other things. I know a practitioner who literally got one of their organ removed and they're like, this is the thing that helped me. And you're like, there was like a terrible infection somewhere in your body. Like, I
mm,
just like you've got to be like real. I'm sorry, I know like multiple people that have like situations or someone that's pushing this marketing based on, oh, this one thing helped me. After I spent $100,000. Well, don't you think something in those $100,000 that you spent helped you somewhere too? Get like, because there's things that help you in the background too. And that's what people don't understand. There's healing that happens in the background without you feeling any aha moment. So I also think that we need to like take time to realize that and to realize when we're scrolling online that there's not a magic pill for this. There are small changes that can help you, and there are multiple systems that need help. But again, there's the basics that really are going to move the needle, and they're going to be the things in your daily practice that get you to the end of these symptoms for sure.
Yes, for sure. Yeah, and I think that's huge and so important because when I was in my acute phase, like, it was this one thing and you're buying all of these things because and then it doesn't work for you and then you're just so discouraged. And yeah, I think it's not one thing. It's a lot of little things and like slowing down, being in nature, going back to what our ancestors kind of did, but adding in a binder because we don't live in the same world as our ancestors and like that is okay, like that's just the reality of our life now and it doesn't mean we're all gonna die and we have all of this fear that comes out too on Instagram, like there's just so much fear that they put into it. And it's doing what you can with what you have because I get that not everyone has access to all of these things and that's okay, that doesn't mean that you can't heal, but like
Yeah.
little thing can be so, so big for your healing. It can be. And kind of I want to talk back about the soul thing too, because I had that, I've grown up in faith and when I went through all of this, I had zero connection to soul, to, God, to any of this. And I felt like I couldn't because it's when your body is in such a state of survival, it's the last thing that your body is trying to do. You're not feeling connected to socialize, connecting to your soul, whatever that may be. You don't feel that. And that means you will feel it again, but when your body is in such a state of survival from these infections, these toxins that we will get out of you eventually, you don't feel that connection. And I want people to realize that that's not a bad thing and that is very actually normal. It's a very normal response of the body.
Mhm.
And I experienced it and, coming out on the other side, which you will come out on the other side. I want to say that you will feel that again. But yeah, it's a very, very real thing. And I don't think that's also mentioned a lot of the time is like the soul aspect. There's so many parts of us, physical, mental, soul, spiritual, like, and it all needs to, I don't know, be taken care of. But yeah, when you have that, you don't feel that connection.
Yeah, when our charge is off, like grounding helped me so much. Like I
Mhm.
literally moved up north so I could ground every day in between calls because I still had to work. I still had to,
Mhm.
I had a team to support. I had patients to support while I was going through maybe the hardest time of my life. I never, it forced me to slow down in certain ways, but had to be present in other ways. It was my livelihood, right? So, like little things like grounding, like breath work, like the small treatments that my husband daily was able to give to me on top of Dr. Leah and I came up with a whole, way to treat people based on the symptoms that I'd been through. And I feel like I understand the body in such a more deep way than I ever could without this experience, but I still, wouldn't wish it on anyone. I will take from it what it has taught me, but I won't say that if I had to do it again that I would take this burden because
Never.
but I see people who aren't getting out of it, right? And I see people who, because they're so scared and they don't even fully trust, like you have to choose someone to trust. So they're not, sometimes I feel like people trust me too much, and some people I feel like trust me not enough. And that's just as a practitioner, but I feel like they're not trusting anyone. They're not trusting their own body. And the things that would help them, like with these people that I talk to, like on a one off that I don't know, maybe don't know me from a full referral or maybe it was online. And I just wish that what they would get from this is like, there's just certain things that the body needs that you won't get through without it. Because then I hear from them a year later and they're worse and worse. And everyone else that we're working with is taking layers off, and I'm not saying it's magic and I'm not saying I have the magic potion or we have the magic potion. I'm just saying I see people and they're not doing great. So these can stay around a long time if you don't get the realizations that we kind of came to and you don't have this support that, and it doesn't have to be with us, but just doing these small things, finding a binder, going in nature, disconnecting from people that are adding to stress in your life as much as you can. Like, you have to go ahead and put yourself first, and your values will change on what you worry about more than anything. Like,
Yes. Yes, I definitely, like you said, would not wish this on anyone. And it's honestly the hardest thing, and it probably will be the hardest thing I've ever done. But you have such a new appreciation, you have a new outlook on life. And I remember just like every day waking up and like asking God, like, give me wisdom. Like if there's something I can take away from this, I pray that you give me wisdom.
Yeah.
And it's something that I have been given. I've been given wisdom. And yes, it's hard. And yes, there's trauma, everyone experiences different hardships. But yeah, like the wisdom and the new appreciation and the joy that you can see in things, like I now have and I'm so grateful for. And yeah, I really anyone that's going through this, like there's answers, there's help, and like when you find it, take it, and start with something little, start with a binder, and like your body will respond. Like I mean, I think everyone, like you said, should be on a binder because yes, your toxins will lower, and that's a starting point to, you know,
Letting your body
healing
because
and
your
letting your
body's
body.
yeah, your body's too overwhelmed right now, so I think
Yes.
very bare minimum, something like that, like, I'm trying to think things that move the needle, like, a ton for me that I could see. Mine was GABA, right? Like, GABA could shut down that scary feeling to me with binders, like, that kinda combination. Melatonin, so inexpensive, so powerful for me, like, I used to be scared of melatonin too because it's getting bad publicity, but it's not true publicity. Our body recognizes it. It is antiviral, antifungal. It helps your immune system. It's the most potent antioxidant. It can literally save your life in a high dose. I just recorded a solo podcast just on melatonin because of how anti-cancer, apoptosis, all of these things, right? So, and it's not even like a herb that's going in and directly killing something. So it seems to be more gentle. Silver, like again, another thing, smear campaign for silver, pH structured silver that's not silver protonate is never going to make you turn blue like the blue guy on Oprah because it doesn't accumulate in your body. You extract all of it. It is a noble metal. I start looking now at metals because I had a metal IV that changed my life as a completely different thing. Why is gold have such a high value right now? Do you know when you take gold inside you, you're more connected to the spiritual world because of the biophotonic ability of gold? Like I've taken gold now every day since, and I think there's a time and a place, and I'm microdosing since I got this IV, and my brain is on another level and clarity is there that wasn't there before. And I'm not saying that'll be the exact response for everyone, but precious metals are precious. I'm starting to see that's what they used to use as IVs to kill infection. It's so anti-cancer that they used to inject it in cancer and it would dissolve it. This is gold. Like, I mean, silver has anti-cancer properties, antioxidant. It kills microbes without killing your good bacteria. It helps to neutralize severe acidity. Like, I mean, all of these things that are cheap and but they're also smeared. Like, and they're also illegal some places, like in the UK, you can't buy you can't buy melatonin. These things are all super, super powerful.
Okay.
Yeah, so melatonin, what else really helped you that I'm missing right now, Emma?
Also working with histamine blockers, like that is something, or like a histamine digest. I know that there's like a few medical ones or like pharmaceutical ones. So like Pepsid AC, Zyrtec. So Pepsid AC with more of like the gut stuff for a lot of people who are having the gut issues. And then Zyrtec for more systemic issues. That can be super, super helpful. I was actually listening to someone speak the other day when I was listening to podcasts on histamine about someone who had sleep issues. And a lot of sleep issues can be because of your histamine being so high. So, like trying a Pepsid or trying a Zyrtec before bed, if you have this crazy insomnia, can really, really help you get the sleep you need, which is then going to help with your healing. And I think one thing I also want to mention real quick is I needed a pharmaceutical medication at the beginning of when all this happened. And I was very, very upset that I needed it because I was 24, I was healthy, this, that, and I didn't want to take anything. Like, I didn't want to take supplements. I didn't want to have to take, a medication here and there because I was, it was then affirming to my body that I was broken. And for people that are in that like stage of life where they need maybe a Pepsid or like a Zyrtec, something to help with their histamine just in the meantime, or like, I needed a beta blocker. My heart rate was 130 constantly. Like I can't live with a heart rate of 130. Like I had to accept that I needed that just for the time being.
Yeah.
Once you start killing and doing all of these things, who knows? Maybe in a week you'll be off of it. Maybe in, 2 months, but it's okay. It's okay to need things a little bit, you know? It's okay to have to
Yeah.
take a medication.
It's definitely humbling, and I've had even issues with some patients recently that are I call them purists now, and I said, "I was like you before." And I was like during this, I had to take doxycycline because when I was trying to kill Lyme just with, like, oregano and herbs, it was my heart was still in pain. I could barely get it, by the way, because they wouldn't believe my Lyme carditis diagnosis that I diagnosed on myself, and it was very hard to get the doxycycline. And, there's a lot of controversy on doxy with Lyme, but I would never suggest doxycycline on someone who has chronic Lyme. But when it's in an acute phase, where mine was, and it showed up in an acute phase and it was attacking my heart, it shut it off in one pill. So you tell me that it didn't do what it was supposed to do in that moment for me, and I will prove you wrong over and over. So I took the doxy and then I did ivermectin, which cleared up a ton of other symptoms. And then I've had to use Pepcid, but just Pepcid doesn't even just work on the histamine, by the way. The famotidine is also inhibitor of the spike protein. So that was used in high doses in acute COVID. And if I did take that at the time of acute COVID and I had it there, but I was still so scared of taking a medication, even though, you know, so I think that there's a time and a place, and these things can work more potently at times than the slow burn of natural medicine in some aspects. Although natural medicine is what I used 90% of the time, that 10% saved me as well. So I think that I also used ketotifen. I used some peptides. I don't know that my esophagus would have healed without the peptides, without the silver, without the Pepcid AC. So, I inhaled exosomes and swallowed exosomes. That's like a more advanced thing. But oh my gosh, was that powerful and like got over the edge. So there's so many things, but I think the underlying thing that Emma was trying to get across is like, it's humbling for your body to need something, but these tools are tools for a reason. They can help you move the needle, and sometimes, honestly, they're just what you need to move the needle. So if you're trying to do it all natural, you may just need this little budge to help you in the short term, and then you can go back to that way. But that's a really good point because, like I said, I used to like our mantra, or one of them for Vegas Clinic, is that we're always non-dogmatic. We're not just going to stick to something because we're sticking to it with no evidence whatsoever. We want to know what truly works in these moments to get people out of these situations. So thank you for bringing that up.
Of course.
I think this was such a powerful episode, and I think we should definitely do it again and dive in more. I really appreciate your vulnerability and how much you shared. I think it's so powerful from someone who went through it, but also someone who is so introspective and also was already in the medical fields, like the way that you could explain the internal conversations, everything like that is very helpful. I'm so thankful that you came on here and shared your story. But is
Yes,
there anything that we missed that you wanna add, like, at all?
I think just one more thing for me, kind of back to being like the perfectionist that I was, I thought I had to do everything to a T in order to heal. And that is not the case. Your body doesn't need perfect to heal. Actually, it's kind of the opposite. When you put less stress, less pressure on yourself, your body then will heal and it will, respond to the supplements and it will move the lymph and, absorb the nutrients. And, for me, I live with my husband's job. I travel a lot. I live in the city. I don't have the benefit, especially in the winter, of always being able to ground and, you know, be completely in Zen nature. And it's just the reality of our life. We don't live in complete Zen anymore. But like finding moments that you can bring Zen into your city, into your chaotic life, lighting a candle, taking a bath, doing, some relaxing music, hugging your loved ones, like realizing that you don't need to be perfect to heal, that you don't need to have, all of these tools to heal, but that incorporating them in the ways that you are able to, like, you may not be able to stop working, and that is okay. Like, everything is okay. And I really just want to, tell people that our bodies are designed to heal, that they will heal, that it's going to be okay. And I know how terrible it is to feel so much fear. And just reminding yourself too that discomfort doesn't mean danger. I said that to myself every day, multiple times a day. I would be talking to myself. I'd put my headphones in and be in the store and talk to myself because I didn't want people to think I was crazy. And
Mhm.
then just reminding too that you are right on track. Even in the the slips and the slopes that go down, you are right on track. Just keep going and you will heal. And finding someone that can help you or encourage you or support you, and finding a binder, because I really do love binders. And yeah, I'm just so happy that I could be here today. I could talk forever about this stuff.
Yeah,
Maybe we
we'll
can do
definitely
it
do it again.
again.
We'll definitely do it again. But we appreciate your time. Thank you so much.
Yeah,
And you can work with Emma through the vegasclinic.com.
awesome. Thank you so much, Dr. Steph.
Thank you.
Bye.